So acne scars are amongst the hardest conditions that we encounter. There's so much variety of different scars, different types of severity, and different depths of scarring. And this is one of the most challenging things we encounter and treat in the clinic. And it is not uncommon for a patient to have done treatments elsewhere and come to our clinic and say that, oh, I've done maybe 3 or 4 sessions of this particular treatment and I haven't seen any results yet. It is sometimes demoralizing, sometimes upsetting for the patient, but it is also important to understand that scar treatments are a little bit of a longer journey compared to perhaps some other conditions. In the case of very severe scarring that involves a lot of fibrosis, possibly from very severe acne in the past or from other mechanisms, the underlying fibrous tissues that stick the skin down or have formed as a result of the injury can be very, very thick and very, very hard to break down. So at the start, when a patient enters a course of treatment, it is not uncommon that the first few treatments might seem like they have not made very significant progress. And that is because our skin typically needs time to remodel. And the remodeling process of the skin after a course of scar treatments, for example, can take up to 6 to 9 months post-treatment to start to show results. During the injury process, for example, severe acne, our body lays down fibrous tissue and scar tissue as an inflammatory response to try to wall off infection and also try to limit infection to an area and not let infection spread. So this defensive mechanism unfortunately results in sometimes very, very thick and fibrotic scarring under the skin. Any scar treatment often involves using controlled injury to the skin to try to stimulate collagen production and, more importantly, collagen remodeling in the skin. Remodeling is a process in which the skin kind of decides which fibrous tissue, which scar tissue it still needs, and breaks down the scar tissue it doesn't need, and also stimulates collagen in areas where it previously might not have produced enough collagen during the scar formation process. This remodeling process takes time, and your body takes time to decide which ones it needs. It takes time to stimulate or to send fibroblasts of collagen producing cells to the area. It also takes time to send scavenger cells to pick up and remove scar tissue that it doesn't need from the area of concern.